Enclomiphine is reputed to be highly effective at increasing testosterone levels. So what exactly is this enclomiphene? Well, it's what is known as a selective estrogen receptor modulator, a SERM, not a SARM, or in other words, it's a progonadotropin. It works by increasing secretion of gonadotropins, which in turn will lead to increased secretion of luteinizing hormone and follicle stimulating hormone, which in turn will lead to increased testosterone production within the testicles. It's also said to increase the size of testicles in humans as well, not animals. So if you were thinking of having testicle enlargement surgery, think again. Enclomiphene could be a better alternative for that. Now, it's not so much a supplement, but more of a medication, and it's primarily used in what is known as testosterone restoration therapy, which is an alternative to TRT. And the testosterone restoration therapy does not suppress the secretion of luteinizing hormone or follicle stimulating hormone. Also, it has no effect on sperm production, and also that is not known to cause infertility, unlike TRT. And for this reason, a lot of doctors are now using enclomiphene more often to treat persistent low testosterone and hypogonadism in men, and it's very, very effective for this purpose. Now, there are some side effects and warnings to be aware of and to consider when looking into enclomiphene. There are some possible side effects: headaches, nausea, dizziness, hot flushes, abdominal pain, mood swings in higher doses, breast sensitivity. But in one particular human study, which was observing the side effects of enclomiphene, and this involved more than 1,000 human subjects, these side effects were found to occur in less than 2% of test candidates. So although these side effects could happen, there's a very small risk that these side effects will occur. Now, one of the things which is recommended highly is not to use alcohol if you are taking enclomiphene. Completely cut alcohol from your diet, because the enclomiphene can increase the risk of dizziness that you get from the alcohol, and it can react in a negative way with alcohol. Now, it's not to be used if you've got a history of liver problems or you have abnormal adrenal or thyroid functioning. This is because there is a risk of liver damage, especially with long-term use. It was also found in one study in animals, not humans, that it suppressed natural DHEA production. The suppression of natural DHEA production can lead to hormonal imbalances. But bearing in mind this study was in animals, there has been no equivalent study in humans, and what necessarily applies to animals does not necessarily correlate to humans. But this is something to be aware of, and the suppression of DHEA production is no good thing when it comes to testosterone, especially in the long term. It's also not advised to use enclomiphene if you have diabetes, because enclomiphene can affect insulin levels, lowering insulin levels, and of course this can cause problems with diabetes. It also has the potential to cause visual problems, retina damage, breathing difficulty and blood clots. Again, these are very rare side effects, and it's unlikely that these will occur, but nevertheless there is a risk that these side effects could occur. Now on to the positives. What does enclomiphene do for your testosterone? Well, in numerous, multiple studies, they all confirm unanimously that it is effective at raising testosterone levels. The studies vary, it's anything from 5% up to 52%. More commonly, the increases have been observed to be around about the 20 to 30% mark. Now, an interesting thing with enclomiphene is when somebody has used enclomiphene, when they stop using the enclomiphene, it's found that the enclomiphene remains active in the system for up to 4 years after stopping use, which is kind of interesting, because maybe not, it continues to give the benefits to testosterone after discontinuing use. It's also been observed in some studies that elevations to testosterone levels remained after use was discontinued, so that's certainly an interesting point for this compound. It's also been proven to be effective for increasing muscle growth, increasing energy and stamina, aiding muscle recovery and reducing tiredness. For this reason, of course, it's growing in popularity with guys who are looking to increase their muscle mass and bodybuilders. The good news and one of the most positive aspects of this medication, supplement, compound is that it does not affect your natural testosterone production. So this makes it a much safer alternative to anabolic steroids and other forms of performance enhancing drugs, which are all, of course, known to affect, suppress, and maybe even shut down natural testosterone production. This is not the case with enclomiphene. So you can see for bodybuilders, this has huge potential in terms of being useful for post-cycle therapy, restoring natural testosterone production after a steroid cycle, and in helping to repair the damage from steroid use. So this is a supplement which has huge potential, no doubt. It's recommended to take enclomiphene early in the morning before 10 o'clock for obvious reasons. Your testosterone levels tend to be higher and your androgen receptors more receptive in the early morning. It's also not recommended to exceed the recommended dose, and to think to yourself, oh, this increases testosterone, if I take more I will increase my testosterone more. Sadly, no. The risk of side effects are significantly increased if you use higher doses, especially the potential to damage the liver. So they recommend not to exceed the recommended dose, which is 25 milligrams per day. Also, it's highly recommended and shown to be more effective with only short-term use, meaning no more than 6 months, that they say. Now, this compound, medication, supplement, whatever you want to call it, has obvious potential for testosterone. Comes with a bit of risk, yes, but if you are looking to increase muscle mass, which a lot of guys are, it's a much safer option to performance enhancing drugs. So for testosterone purposes, enclomiphene is certainly worth a closer look. If you want to optimize your testosterone levels and keep them optimized as you grow older, subscribe to this channel and follow this series.